When teens think about the risks of sex, everyone thinks about pregnancy. But the scary truth is that 41,000 teens and college students contract STDs every day. Next, the Teens in Action crew asked the experts about the realities of STDs. In Burbank, there are many places for young people to find information and to get help if they need it.
Today, we're going to have a panel discussion on STDs. Our panelists are Reve Carrillo from Valley Teen Clinic and our family physician, Dr. Newman. Welcome. I'm going to start with the first question. Could you have an STD and not know about it?
Yes, of course you can have an STD and not know about it because many STDs cause no symptoms at all, especially in women. There's also STDs in men that also do not cause symptoms. Teens and people continue to have sexual intercourse and contact with each other and continue to pass the disease back and forth without even knowing it.
What is the most common question asked at the clinic?
The most common question asked at the clinic is, does the pap smear hurt? And because the first initial visits, they have to get a pap smear. And I usually make them feel very comfortable, and I advise them that most teens feel uncomfortable, not necessarily hurt.
What is the most common reason why teens come to the clinic?
To make sure that they are preventing pregnancy and they are making a difference.
Why are clinics important to teens' health?
It's actually the patient, if you think about it, it's the patient's first really medical decision they have to make by themselves. There's no parents around them telling them, okay, sign here. It could be scary, but we really make the atmosphere very comfortable.
If you walk around in an area where there's a bunch of teens hanging out, no one's going to expect that any of them have a sexually transmitted disease. It's not something you see on their face, but 1 in 10 teenage girls who are sexually active will have chlamydia. So if there's someplace out there where you can find information about sexually transmitted diseases, how to prevent them and how to cure them or how to treat them, then that's where the clinic comes in and can give that advice.
Do you see more girls or guys?
In an average, we see more girls than guys.
Both men and women come to the emergency room because they're usually coming in when they have painful lesions or discharge or actually having symptoms.
How are STDs passed from one person to another?
It's basically physical contact, and oral intercourse, vaginal intercourse, anal. You might not even have intercourse, but if you have an open sore and the person that's infected that has, and you come in contact, there's a possible opening that you'll get.
A lot of sexual contact occurs outside of the use of the condom. You can get many of these things, including warts, gonorrhea, chlamydia, and other things in your mouth. And all those contacts can cause the transmission of a sexually transmitted disease. Condoms most of the time are not used effectively for either pregnancy prevention and especially for STD prevention.
If teens come in and they don't have insurance, what can they do to be seen?
We don't accept insurance, so we can still give them the services they need.
Are STDs curable?
Okay, an example of an STD being cured is genital warts. Actually, there's non-curable and there's curable.
The warts are treated or removed by several ways. One of them is by using a chemical, and one of them is an acid. It's burned off, it's touched to the skin, and it does hurt, and then the warts will be affected by the burn and eventually go away. But that is not one treatment of the burn, but several over weeks.
And if you do have an outbreak of a wart, you can freeze them off.
They also can be cut off by electrocautery. It's actually taking a very, very hot loop and incising the wart off the skin. The virus that causes warts never goes away, and you can get treated for the warts and then have the warts again from the first occurrence of being exposed to that virus. Of course, there's bacterial diseases that can be cured by antibiotics. If you take them in time and you take them appropriately, you can cure an STD that's a bacteria by an antibiotic. But many, many teens don't get treated at all, and they become even worse infections like a pelvic inflammatory disease and can cause scarring. So the biggest thing is prevention, because no, they're not curable, so you want to prevent STDs. And the most important way to prevent STDs is by postponing sex.
Thank you, Dr. Newman, and thank you, Reve Carrillo, for sharing your knowledge with us. We have learned a lot today, and I hope you have too.